In this short video, we will discuss the consequences of war and natural disasters on access to vaccines by exploring a few examples of each scenario, and then summarize the key findings. Both war and natural disasters result in the transition of society into a state of emergency where basic social functions are neglected, including healthcare. Often, affected countries have economic losses such as damaged infrastructure, but also have their populations displaced, making it difficult for healthcare systems to vaccinate them. Around the world, 18.7 million babies do not receive a complete set of vaccinations and are thus vulnerable for life-threatening diseases. An estimated 1.5 million of these will die of diseases that could have been easily and affordably prevented by vaccines. Almost two-thirds of all unvaccinated children live in conflict-affected countries. Starting with the war in Bosnia and Herzegovina, the capital city of Sarajevo was under siege for 44 months, from April 1992 to December 1995. During the siege, the city was almost completely cut off from the rest of the country. It suffered shortages in electricity, food, water, gas, and medicines. The region's mandatory immunization program was disrupted during this period. Consequences of that were still seen after a decade. In the beginning of March 2014, a measles outbreak was registered. Almost all of the cases were unvaccinated, and 43% of them can be traced back to low coverage during the war period. So why did the immunization program fall apart? The country was facing so many difficulties, starting with a disrupted supply of the necessary vaccines and problems in storing them and maintaining the cold chain, to disrupted implementation of the vaccination program due to lack of organization of the healthcare services and the behavior of people. But most importantly, it was due to the difficulty of bringing the children to vaccination. This is because there was a risk associated with bringing them to the vaccination centers, but also because many children were orphaned or wounded, and also because of the negligence of some of the parents and the healthcare professionals. Second, Syria. Syria is a case study in how a country can shift dramatically from stability to turmoil in just a few short years. Immunization rates in Syria were among the highest in the Eastern Mediterranean region until conflict broke out. More than 90% of the Syrian children were vaccinated against measles and polio, and there had been no case of a child being paralyzed by polio since the 1990s. 5 years of war had taken a toll on the immunization rates and put children's health at risk. By 2014, the immunization rates in Syria had plummeted to 43%. Sadly, the country experienced a polio outbreak in 2013, leaving 35 children paralyzed, and with subsequent epidemics in measles and pertussis in 2014. Just like the case in Bosnia and Herzegovina, the civil unrest in Syria had its negative effect on the infrastructure that is necessary for effective delivery of healthcare service. Particularly, the destruction of the transportation system has made it difficult to deliver vaccines to rural areas. Destruction in the communication systems, such as telephone networks and radio, had also had its impact on the vaccination program through being unable to inform the populations in conflict areas of national immunization days. Unlike the case in Bosnia and Herzegovina or Syria, conflict in Pakistan has fueled mistrust in vaccination, sparked when the USCIA used the guise of a vaccination campaign in order to search for and kill Osama bin Laden. The local community thus saw polio vaccination, as a Western conspiracy, and some of them even questioned the motives to polio vaccination campaigns. Militants even banned vaccination in some of the vulnerable areas because of this sentiment. Others, fearing militants who were against vaccination, refrained from getting vaccinated themselves. Other case scenarios could be war-torn countries like South Sudan, Somalia, and Chad, where only approximately 39% of the children receive their basic childhood vaccination, the lowest vaccination rates in any country in the world. Humanitarian crises and emergencies are ubiquitous and frequently unpredictable in time and location. From flooding in Namibia, Mozambique, Malawi, and Zambia, drought in Madagascar, Zimbabwe, and Namibia, cyclones in Madagascar, to earthquakes in Haiti and Pakistan, these emergencies have become a common phenomenon globally. In addition to war in Pakistan, the country has been experiencing floods and earthquakes over the past few years. The recent heavy fall in 2010 over many areas in Pakistan, including 5 districts of Punjab and areas in Sindh, has resulted in the halt to inoculation of 4.8 million children in Pakistan. Damage to transportation infrastructure leaves many children geographically barred from access to vaccines as well. The result? Pakistan is one of the 3 countries unable to eliminate polio. The earthquake that struck Haiti in January 2010 caused 1.5 million people to be evacuated to temporary camps. The Haitian Ministry of Public Health and Population and global immunization partners developed a plan to deliver vaccines to these refugees. Since no recommendations existed for monitoring post-disaster vaccination campaigns, a strategy was vital to ensure that the immunization targets set for the temporary camps were achieved. A rapid monitoring and mop-up vaccination program was implemented for DTP, measles, and rubella. However, due to the shortage of vaccination teams, the frequent movement of people from camp to camp, and the identification of camps that had not been recorded when the campaign began, this level of mop-up vaccination was impractical. To conclude, war and natural disasters impose an enormous disruption in the healthcare systems of the affected regions. Access to life-saving immunizations is very often a casualty of the breakdown of these systems. Children who are affected by conflict are pushed into a downward spiral of deprivation that robs them of their health and, by extension, their futures. Vaccines remain an indispensable tool to help break this vicious cycle. Therefore, unimpeded access to vaccines should be considered as a critical intervention strategy in emergency responses to these situations. A sustained access of vaccines would avert the emergence of vaccine-preventable diseases that are imposed by these humanitarian emergencies.